Imagine you are on the most glorious vacation, tropical environment, sun, ocean waves, an incredibly peaceful getaway with lush forests and beautiful flowers, and of course your favorite person is there with you. And then you have the most intense body aches and high fever, so bad that you truly cannot get out of bed to drink water because your joints hurt so badly. Standing upright is too painful that if you do stand up, you're really just bent over because your joints will not let you straighten them out. Hi everyone, I'm Dr. Venk, emergency physician, husband, and father to 3 amazing boys, and today we're talking about chikungunya virus, a disease that is suddenly back in the news after New York reported its first locally acquired case in 6 years. In addition, the CDC has put forth a bulletin on September 26th that lists ongoing outbreaks of chikungunya in 7 countries and travel advisories for an additional 8 countries. Now, anytime a disease with a long, complicated name shows up in the headlines, of course, it gets us a little worried, and understandably so. I figure who better to break it down than a physician whose last name sometimes some people might feel is also long and complicated and scary. So, in this video, I'm going to walk you through everything you need to know, what chikungunya actually is, how it spreads, what symptoms to watch out for, when should you go to the ER, how dangerous is this really, how doctors might make the diagnosis, and how is chikungunya treated. Also, as I typically do, I will provide a downloadable sheet that provides a summary of the disease and a guide or framework that you can take notes on so that you can maximize any ER or healthcare visit that might be related to possible chikungunya infection. My hope is that by the end of this video, you will feel more empowered and less scared. What is chikungunya? The word chikungunya comes from Makonde, an East African language, and means that which bends up our joints. And that gives you a big clue as to what this virus does. Chikungunya is caused by a virus that infects humans through mosquitoes, mainly from 2 types, Aedes aegypti and Aedes albopictus, also called the Asian tiger mosquito. These mosquitoes are active mostly during the daytime. In fact, their peak activity is after sunrise and just after sunset. This is different than the Anopheles mosquito, the one that typically is thought to spread malaria. Those mosquitoes bite mostly at night, especially in the late evening and early morning hours. The Aedes aegypti and albopictus mosquitoes are also known as the main vectors for several other infections, including dengue fever, Zika virus, and yellow fever viruses. Here's how transmission happens. A mosquito bites a person who's infected with the chikungunya virus. The virus multiplies inside that mosquito, and then when that same mosquito bites another person, boom, it passes on the infection. It's not spread through coughing, sneezing, touching. It doesn't spread through water or food. But because mosquitoes can breed in even tiny amounts of standing water, even as small as a bottle cap that's overturned, outbreaks can spread quickly, especially in warm, humid areas. Now let's talk about what happens if you get infected. After a person is bitten, there's usually a period of 3 to 7 days where you don't feel anything different. And then symptoms begin, and they begin quickly. High fever, often over 102 degrees Fahrenheit, that's 39 degrees Celsius, associated with severe joint pain, especially in the hands, the wrists, knees, and ankles. This usually affects joints on both the right and left sides of the body, but does not affect the back very much in most cases. There's also a lot of muscle pains, headaches, fatigue, and many people will report a rash that looks a lot like measles or red blotches on the skin. Most people describe that rash mainly in the trunk. Also, let's talk about the joint pain. It's the worst part of the disease, at least for the majority of the people. It can make walking or even using your hands really difficult, which is why the name was given. What's the good news? The good news Most people start to feel better in about a week. Very few, mainly we're talking about older adults, may have joint pains and stiffness that lasts for weeks or even months. And extremely tiny children can also have severe disease and be very sick. Go to the ER if you have fever and severe joint pain that you cannot manage at home. If you feel dehydrated, that means you feel dizzy or lightheaded, you have dry mouth, you're not peeing very much, and when you do, it's really concentrated. Of course, if you experience severe headache, confusion, neck stiffness, these are things that should prompt an emergency department evaluation. Also, if you have persistent vomiting or abdominal pain, and certainly any bleeding like from the gums or nose, that could be a sign of something different than chikungunya and something more dangerous, and so you should get that checked out. Also, special groups of people, such as those who are pregnant, elderly, those who have chronic conditions like diabetes, heart or lung disease, weakened immune systems, you should consider getting evaluated earlier rather than later. For most healthy adults, though, this is an illness that can be managed at home, but we welcome anyone who's worried for any reason to come to the emergency department to get checked out just to be safe. In the emergency department or clinic, we'll first take a good history and physical exam. This will include talking about your recent travel, how long you've been feeling ill, when did those symptoms occur, and in what order. Also, what have you done to try and help yourself? That might help lead to an answer as well. In areas where chikungunya is very common, no further testing may be needed. History and physical alone might give enough information for your doctors to make that diagnosis. If there's consideration of other more dangerous infections, let's talk about dengue fever, for example, then testing for specific infection or viruses might be helpful. When we think about what different tests somebody might have and what results they might show, if for some reason you had blood work to look at your complete blood count, it might show that your lymphocyte count is quite low. Also, your platelets might be quite low as well. In contrast, the AST, which is a test related to your liver, is often elevated, as is a test for inflammation called the CRP or C-reactive protein. None of these tests in isolation really are enough to make the diagnosis of chikungunya, but they can help raise the suspicion on the part of your treating physician, physician assistant, or nurse practitioner. They can happen for a variety of reasons and a variety of circumstances. So if you have these lab abnormalities, I don't want to suggest that that means you have chikungunya infection. The most specific test is a PCR test, and this can be one that can target one virus or several viruses. It looks for the virus's genetic material in your blood, and it's not likely to be returned within the emergency department visit. So we would have to begin treatment and make decisions even without that information. A PCR test is really good in the first week of infection when people are having the most symptoms like fever and body aches. After that time of acute infection, when the fever has gotten better, the body aches are generally improving, we can check for immune system response. In particular, we're looking for the IgM antibody to chikungunya. These tests are usually done through state health departments or the CDC when there's a concern for local spread. There's no specific antiviral drug that cures chikungunya. Treatment is what doctors call supportive care. We treat your symptoms while your body clears the virus. This hinges upon three main things. First, fluids. We need to stay hydrated. Second, rest. We need to let the body recover from this infection. 3, pain and fever management with medicines like acetaminophen. You might be wondering about ibuprofen. Well, ibuprofen is a great medicine for inflammation and for the pain and fever that comes with chikungunya. The only hesitancy would be ibuprofen might increase your risk of having bleeding, as would aspirin. It's small, but a little bit of bleeding might change the concern of the situation and make people think you have dengue fever, which is much worse. And so it would be important to be engaged with your healthcare professional to make sure that they think it's okay for you to start ibuprofen and make sure you're not having bleeding already. Most people start feeling better within 7 to 10 days, though joint pain, like I said, can linger for a few weeks to months, especially in older persons. The The virus is usually cleared from the body within a week, but the immune response, especially that inflammation in your joints, can hang around much longer. Serious complications from chikungunya are rare, thankfully, but they can happen, especially we're talking about in those of extreme age, newborns infected during childbirth, and elderly adults, and those with a lot of medical problems like heart disease, lung disease, diabetes, weakened immune systems are most at risk for having complications. Thankfully, fatalities are very uncommon, but when they do occur, it's because of complications like dehydration, organ failure, or an infection in someone who's got a weakened immune system, or it caused neurologic symptoms like meningitis, encephalitis, altered mental status. Let's talk about prevention. Since there's no vaccine yet widely available for chikungunya, the best protection is mosquito control and bite prevention. Daytime prevention of mosquito bites includes primarily three things. First, you go around and minimize areas of standing water, even as small as a bottle cap. That's enough water for mosquitoes to reproduce. Second, consider using spatial repellents like pyrethroid spatial repellents. Transfluthrin, metofluthrin are some of the active ingredients in that, and they can reduce infection transmission by about 1/3. Treating your clothes with insecticides like permethrin can be very helpful. It reduces mosquitoes landing upon you by about 60%, and when they land, it reduces biting by almost 100% in most lab models. That protection will wane if you wash your clothes or iron them, so you'll need to reapply that insecticide regularly. And remember, if you've been sick with chikungunya, don't get bitten again for about a week after the symptoms start, because that's when you're going to be most able to transmit that virus to somebody else or into that mosquito back into the community. Speaking of, if you've had chikungunya in your life, the really cool thing is it's very unusual for you to get it again. That immunity that you'll build is fantastic against this virus. So you may be wondering about a vaccine. It seems like a prime target. Well, there is not yet a vaccine available. There are some very promising work being done on this area that may potentially lead to a vaccine in the future, but none has been released as of yet. So, to recap, chikungunya can cause a miserable week of fever, joint pains, but for most people, it's not dangerous. It's just very uncomfortable. If you know how it spreads, how to protect yourself, and when to seek medical help, you can keep yourself and your loved ones safe. Given that New York has seen its first case, it's possible some more cases may show up, but it's also possible that we won't see much more activity from chikungunya. After all, at least here in Minnesota, the mosquito season is coming to a close. Also, don't forget to stick around to the end of the video. I'm going to share a QR code momentarily that allows you to download a handout on chikungunya virus. In the handout is a summary of most of the important points that we talked about just now, and an area where you can document your symptoms and keep track of what you want to tell your doctor when you go to see them. You can also click the link in your description if that's easier for you. If you found this video helpful, please like, subscribe, and share it. It helps others find trustworthy medical information when they need it most. And I spend hours making this video for you. And that little tap on the follow or like icon will be thank you enough, I promise. Finally, here's to smart health for smarter living.